So like what you actually both said already, it could be nothing, it could be something very serious and very important. So I think always just, even if it's just one medical appointment, just seek, some medical advice, and review.
Hello, everyone, and thank you for tuning in to watch us. Today, we're going to be talking about urinary frequency in boys. And the reason we're talking about it is because we do have a lot of concerns. We have a lot of young boys coming in, and parents are like, my child is passing urine 10 minutes, every 10 times in an hour. And they're concerned because it's like there must be something going on. Maybe he has a urinary tract infection. But meanwhile, a lot of the time you ask, does it seem like it's painful when he's peeing? And most times the answer is no. So when we have parents coming in and they're complaining about this urinary frequency, we do our usual history, we do our exam, we examine the children. Most times, especially in boys, they're fine. There's nothing on exam. And so we tend to do this thing where it's like, okay, could it be that they have a lot of poop, where there's poop pressing on the bladder and making children want to pee, giving that urge to pee? And we compare it to a pregnant mom. When a mother gets pregnant, the uterus gets bigger because there's a baby in there and it starts to press on the bladder. And a lot of women, when they just get pregnant, they start to complain, oh, I'm always peeing. I'm always going to the restroom. Like in an hour, I can go 10 times, 5 times. It's a lot. And the reason is there's something pressing on the bladder. And that's why pregnant women go to the bathroom. So many boys, when they come in, the first thing we want to do is, after doing a history and physical, we want to do labs. And we want to check for urinalysis. We do a urinalysis. So we ask them to give us a urine sample. When we check the urine, we're looking for infection, because that's one of the common reasons that a child will have that frequency and urinary frequency wanting to go all the time. If the urine comes back normal, which is what we expect, then we actually say, okay, we're going to do an x-ray. And when we do x-rays, we're like, okay, mom, sometimes just like a pregnant woman, the uterus is pressing on the bladder. Sometimes poop can be pressing on the bladder too in young boys. And 99% of the time we do that x-ray and lo and behold, there's the abdomen is packed full of poop. So I tell my moms, I say, look, your child might be pooping every day, and that's usually the history. Oh, they're not constipated and they poop every day. But if your child is pooping and the poop is like this, and they have this amount of poop left in their stomach, guess what? There's a lot of poop in there that's pressing on the bladder, and that will cause symptoms of urinary frequency. So we usually do the x-ray, and most times the radiologist will read it as a normal x-ray, just because there's no obstruction. So I tell parents, bring that x-ray back to me. I want to see the actual picture. And when we look at the picture, everything is full of poop. Even in America, it's like, oh, there's a normal x-ray, but it's packed full of poop. So once we are able to do the x-ray and we see that there's a lot of poop, we put them on Miralax or any of the stool softeners. They poop, and we say, let's see them back in a week. And lo and behold, urinary frequency goes away.
Reduces.
So it's one common thing. And then we also go over dietary counseling, make sure they're eating more fruits and vegetables. And moms, dads, please make sure your children are eating vegetables. In Nigeria, the diet, what are your opinions? Because the diet is packed full of starch. We have a lot of starch.
I think it's a worldwide issue, really, trying to get kids to eat anything that's green or orange or
Or red.
vegetables or exactly. So I think you just have to just do your best to just try and just find a way to make them eat better. Really, more fiber.
And fries don't count as veg. French fries don't count as veg.
Like,
So-
corn is a vegetable.
Corn-
Well,
Urinary frequency. I guess the history is very important because when it comes to taking the history, you want to make sure that you're not dealing with diabetes. Sorry.
that's a very good differential that you just
Very important
very
because yes, when they begin to pee frequently, large volumes, and they're drinking a lot of water and they're losing weight, sometimes it could be diabetes.
Yes,
So
absolutely.
yes, we can't just dismiss that. Dismiss it. The parents should not be dismissive of urinary frequency. So please complain if you have a child that's having urinary frequency.
That's a very good
Yeah,
point. And when you do a urinalysis, you simply plus what plus glucose. So that urinalysis is so important. Very, very important.
Very
Our doctors out there, don't dismiss it. Always check for the urine.
Yes.
Make sure that there's
Always
But-
do a check.
Well, they always used to say when I was in residency that when you do a urinalysis, that's the chemical, you're actually getting a mirror image of what's going on in the body. Because from that urinalysis, you can get the specific gravity of urine If it's high, you know that the child is dehydrated.
Mhm.
You can get ketones
Yes.
if they're breaking down fats.
Exactly.
Yes.
Fat metabolism, they haven't eaten. What else? You can get
So many
Yeah.
things. Doesn't matter about, I think, as some sort
Infections.
of infections.
infections. Yeah,
Infections.
there's fat in the urine. There's bacteria on the microscopy. And then you send the culture, you're growing E. coli,
Yeah.
which is one of the commonest.
Yeah.
So yeah, it's so important.
Yeah.
So thank you.
Yeah. So just to add, so like what you actually both said already, it could be nothing. It could be
Yes.
something very serious and very important.
Yeah.
So I think always just, even if it's just one medical appointment, just seek, some medical advice, and review. But what I found as well from my experience, sometimes it's a habit. These boys just, I don't know, they just develop this habit of just going to the loo. They don't completely empty their bladders. They pee a little bit. They want to play with their friends. They run out. They go back to play football.
Yeah.
Oh, I need to pee again. They go back. So
Or
you need
they're
to
on their
train
video
them.
games.
Yeah.
They don't want to
They
do
don't-
it.
exactly.
Their dancers like, oh,
They
let
go,
me-
yeah, let me pee for 2 seconds. Let me come back to my,
yes.
So as the parents, you need to get them to the habit of let them stay there, empty their bladder completely before they leave the toilet.
Yeah.
And that habit is broken. So yeah, interesting.
I had a child from Ecuador that came in, and the concern was the child's stomach was big and she was peeing a lot frequently. And really, I looked at the child, 2 years old, and the child was potty trained, but she was peeing more frequently than usual. And that was just one episode. So we said, okay, let's just do an x-ray. They called me from radiology and said, Dr. Sanusi, we want to report this x-ray to you. And the child had a big mass.
Oh my goodness.
The mass was pressing on the bladder
Bladder.
Oh wow.
and must have grown acutely.
Oh.
But that was
Wow.
one rare reason, but because of the
Wow,
mass pressure on the
serious
bladder.
reason, yeah.
So it doesn't have to be only poop. You can have masses, and it was
Masses.
I think it was a dysmaxic kidney.
Wow.
It was
wow.
abnormal kidney.
Yeah.
But very, very, very interesting.
Very
And-
interesting.
And we've been doing this for decades, but we always see something new.
Very
Always
rare.
I am humbled because
You really
I
have
tell
never
people-
seen it. There's no time when you think you've seen it
No.
all.
Oh, no.
And I tell parents,
No.
sometimes they ask me, what do you think
Yeah.
this is? I said, don't. I said, I'm a doctor at 30 years, but I can still say I don't
You
know.
don't know. And that's
Let's-
okay.
yes,
It's
and it's
okay.
okay to say,
Yeah.
I don't know.
Yeah.
And there's no stupid question in
No,
medicine because I ask, So always remember, parents, ask. If you're worried about anything, bring your child in. We'll be happy to see your child and take care of your child. All right. So thank you. See, 3 heads are always better than one.
You know.
I'm excited about that. So thank you very much.
Thank you very
Really
much, Lucy.
appreciate you guys. All right. Thank you, and we'll see you next time. Bye-bye.